Good morning and welcome. Good morning, everyone. I'd like to welcome you all to the Alzheimer's Association's 7th Annual Reason to Hope Breakfast. I'm Andrea Yoke, and I'm an attorney with Thompson McMullen, but this morning I speak to you as president of the Alzheimer's Association Greater Richmond Chapter Board. I've been on the board for almost 5 years and active with the association for nearly 10. Like so many in this room, Alzheimer's has affected me personally. When I was in college, my grandma was diagnosed with the disease. When she died, I remember that my aunt did not cry. After more than a decade of watching her mother slip away, there were no more tears left. Grandma had already been gone a long time. Though she may be gone, my fight continues. I support the Alzheimer's Association because no one should have to go through what my family went through and what so many of your families have gone through. I fight to end Alzheimer's so my niece doesn't have to experience what I did. Things like frantically searching the house and yard for Grandma, only to find her facing a wall in a coat closet. Having Grandma forget her birthday, her name, and then ultimately her face. Looking around the room, it's evident that I am not alone in this fight. We all share the Alzheimer's Association's vision of a world without Alzheimer's. Together, we must win, and we will win. Now, I would like to take a minute to thank our small but extremely dedicated association staff. The success of our chapter is due in no small measure to the tireless work of these individuals. Will the staff please stand and be recognized? I would also ask that the board members stand at this time. The breakfast would not be possible without our sponsors. Our title sponsor this year is Genworth, and our presenting sponsor is Markel Corporation. Additional sponsors include the Memory Center of Richmond, Seniors Guide, Thompson McMullen, UCrop's Dress Express, Door-to-Door Solutions, Our Lady of Hope Health Center, Parker, Pollard, Wilton, and Peden, Tavener and Barron, and Lift Caregiving. Thank you for your continued support of the Alzheimer's Association. I would also like to thank this year's table hosts. Thank you for your continued dedication and support. A list of our sponsors and table hosts can be found in your programs. Again, I thank you all for being here this morning to share our hope. Now, please take a few minutes to enjoy your breakfast and each other's company.
Good morning. Wow. Thank you all for coming out on this lovely day. We really appreciate you being here. I'm Sherry Peterson, and for nearly 17 years, I have had the privilege to serve as the CEO of the Alzheimer's Association Greater Richmond Chapter. Working with those affected with Alzheimer's and dementia, like those who shared their stories in the video, has been an honor and an inspiration. Tragically, so many of us in this room know all too well the incredible heartache the news of a loved one diagnosed with Alzheimer's brings. Our first thoughts may be, what now? Where do I turn? What do I do? Thousands have turned to the Greater Richmond chapter, and thousands more will do so this year. Alzheimer's is a fatal disease and the 6th leading cause of death in the United States, and kills more people every year than breast cancer and prostate cancer combined. Many of you have heard the phrase, the tsunami of Alzheimer's, but what does it mean? Is it just a buzz phrase? Simply, no. It is real, and it will happen unless we as a community come together and retake our future. The statistics are startling. Today, every 67 seconds, someone develops Alzheimer's. That means, while we are here this morning, 54 people will develop Alzheimer's. By 2050, this rate will jump dramatically to 1 every 33 seconds, and the number of people aged 65 and older with the disease may nearly triple. Every day, 10,000 baby boomers turn 65. After that milestone birthday, their risk for developing Alzheimer's will double every 5 years, and it is estimated that 10 million of us, that's 10 million baby boomers like me and many of you, will develop Alzheimer's disease. Too many of us will spend our retirement years either with Alzheimer's or caring for someone we love with it. There's no treatment, there's no cure, and unless this changes, Alzheimer's will become the defining disease of the baby boom generation. Today, more than 130,000 Virginians are living with Alzheimer's. By 2025, it is estimated that 190,000 Virginians will have Alzheimer's. That's an increase of 46%. It is also estimated that 200,000 Americans under the age of 65 have younger onset Alzheimer's. And with Julianne Moore's Oscar-winning performance in Still Alice, it is our hope that people begin to understand that Alzheimer's is not just a disease of the elderly. Alzheimer's can and does strike individuals as young as 40. Anyone and everyone who has a brain is at risk of developing Alzheimer's. No matter the age of diagnosis, Alzheimer's robs spouses of lifetime companions and children of their parents and grandparents. Caregivers suffer because caring for someone with Alzheimer's negatively affects the caregiver's health, employment, income, and financial security. And that is nothing compared to the human cost, the toll it takes watching the disease steal bits and pieces of our loved ones until they no longer recognize us or themselves. Something far too many of us have experienced firsthand. The heartache and toll on individuals, their caregivers, and their families is devastating, but it doesn't stop there. Alzheimer's takes a toll on our entire society. In 2015, the costs associated with care of those living with Alzheimer's and other dementias will total an estimated $226 billion. Medicare and Medicaid will pay 68% of those costs. By 2050, without a treatment or a cure, costs are projected to increase to more than $1.1 trillion. That is trillion with a T. But thanks to the ongoing support of individuals like you, the Alzheimer's Association is here to help. The Greater Richmond chapter is based in Innsbruck and has regional offices in Fredericksburg, Colonial Heights, and Gloucester. We may have a modest budget and a small staff, but we work tirelessly to serve our neighbors in need. We provide a 24/7 telephone helpline, and no matter what time of day or night or what day you call, you will get to talk to a live person. We have support groups for both those with the disease and their caregivers. We offer educational programs for family caregivers and professionals and the community at large. We offer one-on-one care consultation to families to help them develop immediate and long-term plans, and we offer scholarships to give caregivers a break from their caregiving responsibilities. We offer safety programs because we know that 60% of those with the disease will wander. The chapter supports research through our national association. The The Alzheimer's Association is the largest private funder of Alzheimer's research, having invested over $300 million in Alzheimer's research. While each person's journey through Alzheimer's is different, there is one constant in this disease that no other disease shares. Alzheimer's is the only cause of death among the top 10 in the United States that cannot be prevented, cured, or even slowed. There are no survivors, but there are reasons to hope. We have done it before. Death rates from breast cancer and prostate cancer, heart disease, stroke, and HIV have decreased. We can do the same with Alzheimer's. We all look forward to a world without Alzheimer's disease. I am now pleased to introduce Barb Cole, who will share her Alzheimer's journey with you.
Well, good morning, everyone. Look who's all bright-eyed and bushy-tailed out there. I'm here today because I know a little bit about living with Alzheimer's disease. I hope to raise awareness, dispel a few myths, and open up the dialogue about Alzheimer's. What you may not know is that Alzheimer's can affect people in their 50s, their 40s, even younger. And the brains of people with Alzheimer's disease are affected 15 to 20 years before they show any outward signs or symptoms. It is highly likely that in this audience today, there are people in the very earliest stage of the disease who don't even know they have it and won't until they start to show the signs of Alzheimer's years from now. I am one of the approximately 200,000 people in the U.S. who have what is called to early onset or younger onset Alzheimer's disease, someone under the age of 65, someone who experiences cognitive impairment and has been diagnosed with the disease. I guess I should begin by telling a little bit about myself. I am a wife, a mother of 2 daughters, a career woman with a master's degree in business. I've always been a bit of an overachiever. I never met an obstacle I couldn't overcome, get around, or just power through. I think that is because I'm an eternal optimist, always believing in possibilities rather than focusing on difficulties. I was diagnosed with younger onset Alzheimer's in 2010, but it took several years of the symptoms and tests before I actually received the diagnosis. A question I frequently hear is, what were your symptoms? What made you think there was something wrong? Looking back, I was in my late 40s when I first noticed some very subtle changes taking place. I worked with financials every day, and I could crunch complicated equations in my head. I began to notice that routine tasks were taking longer, especially things involving math. I could no longer do even the really simple arithmetic in my head. I had to rely on a calculator. I would compensate, still working, by double-checking and triple-checking to make sure there were no errors. I began to notice other things. I wasn't lightning fast on the keyboard to begin with, about 60 words per minute, but I slowed to about 9 words per minute. I caught myself having to reread paragraphs in the newspaper, not really comprehending what I just read. And I was having trouble expressing myself in conversations. I struggled to find the words to express what I wanted to say. I had trouble following the steps in recipes. Did I already add the vanilla? Did I leave out the baking soda? I did not know. And favorite dishes I had prepared for years from memory, I had to start looking up in a cookbook. When I took a shower, sometimes I couldn't remember if I washed my hair, or if I shampooed it, did I rinse out the conditioner? I'm not even sure about that today, to tell you the truth. I began to have to check my toothbrush to see if it was wet so I would know whether or not I'd actually brushed my teeth. And I was having trouble remembering things like my social security number, my age. I'm not sure that's such a bad thing. Or what year my father died. Perhaps most upsetting was occasionally I would draw complete blanks, feel confused and disoriented. Not all the time, mind you, but often enough to make me concerned. Then I forgot how to get to places, familiar places, places I'd been to dozens of times, like the dentist's office. I began having trouble meeting deadlines at work. Tasks seemed to take so much longer to complete. When I could no longer remember the security codes to access my work sites, I knew it was time to see a doctor. There are many possibilities that could account for memory issues. Serious things like a stroke, a brain tumor, thyroid problems, Parkinson's or other diseases, menopause, stress, even depression, or something as benign as a vitamin deficiency. For the next several years, I underwent a series of exams, CT scans, blood tests to help determine the cause. A neurologist ordered MRIs and brain scans, conducted neurological tests. Then I was referred to MCV for extensive neuropsychological testing. The tests indicated my cognitive function was far below what was expected for a person of my age and my level of education. And certain areas of my brain weren't lighting up like they should be. The neurologist said I had some form of dementia, probably Alzheimer's. There was another test suggested, newer and expensive, and insurance companies don't like to pay for it, but it could confirm or dispel the diagnosis of younger onset Alzheimer's. So a PET scan of the brain was performed. You know, I really thought it would be easier to go through life, the rest of my life, without knowing definitively if I had the disease. A disease with no cure, no effective treatment, but a very dreadful and definite progression. The eventual loss of my memories, and with that, myself. Well, the PET scan confirmed the diagnosis, Alzheimer's disease. I guess you could say this was a life-changing event, not only for me, but for my family. I could not imagine a more horrible journey for my husband, Rich, who's back there today, and my daughters, Kimberly and Caroline. You know, for most people to look at me, to hear me speak, very few would think I have a problem. Yes, I sometimes speak haltingly. It helps to read off a script. I have trouble finding words. I lose my train of thought. Sometimes I repeat myself. And sometimes I repeat myself. But I knew there was more to it. I, more than anyone else, saw the subtle decline. I knew I was in the earlier stages of the disease. I might be able to function for years, with a gradual decline coming over 5 or 10 years or even more. Or the decline could be significant and rapid. There was no way to know how the dementia would progress in my case, how rapidly my cognitive function would decline. Every case of Alzheimer's is different. The only certainty was the final outcome, not when, but how it would eventually end. Denial, anger, bargaining, depression, and maybe one day acceptance. These are the stages of grief. My family began the emotional journey in denial. I skipped over denial and bargaining stages because I'd pretty much been doing that for the previous 2 years. I was going back and forth between anger and depression, just trying to find a way to cope. When I could no longer perform all the duties of my job, I lost my employment. And with it, a big part of my identity and self-worth. I debated whether to share my diagnosis with friends and family. I finally decided, painfully, that hiding the diagnosis because of stigma and shame served no worthwhile purpose, and it was a heavy burden for me to carry alone. What I was not prepared for were the reactions I received from a few family members and several of my friends and coworkers. Some refused to believe there was anything wrong with me. I was too young. I was functioning. I knew their names. I certainly didn't fit the stereotype of an elderly person with dementia. This put me in the awkward position of having to defend the diagnosis, try to prove to people the symptoms that I was having were real. I had to justify to others what I was experiencing. I don't think this happens very much when people share a diagnosis of cancer or diabetes or heart disease. No one says, well, the doctors are wrong. It is uncomfortable to discuss the disease, the progression of the symptoms, the eventual change in personality. Some of my friends did not dispute the diagnosis. They just simply avoided talking about it. And they avoided me. My support system disappeared. Most of my friends and even some of my relatives quit calling, quit socializing. I felt completely isolated and very much alone. I did not know anyone else who had the disease, anyone who was in the early stages, who was still communicating and functioning. And certainly I didn't know anything about younger onset Alzheimer's disease. The emotional pain was tough. The idea of putting my family through the ordeal of watching as I lose my cherished memories of them to become a burden to them, and one day to not know who they are, was very nearly too much to bear. Through isolation and a certain sense of despair, I eventually sought out help. I found that help through the Alzheimer's Association. On their website, alzheimers.org, I found a wealth of information about the signs and symptoms, the myths, the misconceptions, the 7 stages of the disease, and what's going on in research, the really hopeful stuff. I learned about younger onset Alzheimer's. I connected with the regional director of my local office of the Alzheimer's Association, Lori Myers. She's here today as well. She encouraged me to attend their support group for families, caregivers, and people with Alzheimer's and related dementias. I attended the support group 2 or 3 times, but felt out of place. Nearly all of the people in the group had progressed to more advanced stages of dementia. Some had difficulty expressing their thoughts. Others could speak well enough, but would repeat themselves over and over in a monologue. It was there at those meetings that I came face to face with my own future, and it was terrifying. I needed to talk to someone who was still in the early stages of dementia, someone who was having to cope with the stigma, the changed relationships, the loss of friends, loss of employment, and to a degree, loss of identity, purpose, and self-worth. In a moment of darkness, I shared my feelings with Lori Myers. And you know, she kicked into action and formed a coffee and support group for people in the early stages of dementia. All I can say is thank God for the Alzheimer's Association and for Lori Myers. I am no longer alone in this journey, and no one else needs to be either. Some people, when they are confronted with some of the tougher challenges in life, will ask, why me? In my case, I think I know the answer. To make something positive come out of this journey into Alzheimer's. It's up to me to make a difference. To make a commitment to educate the public about Alzheimer's disease while I still can. The end of Alzheimer's starts with me. I hope to communicate the facts about Alzheimer's dementia, its huge emotional and financial impact on families. Whether you have $1,000 or $1 million, the costs of medical care, home health care, and assisted living for Alzheimer's patients will drain every cent you have. I hope to raise awareness to this growing national health care crisis that has such a devastating consequence for the U.S. economy, a crisis that is reaching epidemic proportions that requires action now. I hope to advocate for increased funding and research necessary to find a cure. I hope to dispel the myths and misconceptions that Alzheimer's is a natural part of aging. It's not. That only older people get Alzheimer's. Not true. That there are treatments available to stop the progression of Alzheimer's. There aren't. And that Alzheimer's is not fatal. It is. I hope by being here to help end the stigma associated with Alzheimer's, by openly sharing my personal journey and encouraging others to talk about it. And by being proof, right here, people living with Alzheimer's and related dementias can still be functioning, can still be productive, and can still live meaningful lives and have value. So now, folks, it's up to you. The end of Alzheimer's starts with you. Will you do your part? Get involved. Contact your state and federal representatives and ask them to do their part to increase funding for critical research and to affect public policy in a productive way. Get others involved. Talk about it. If they don't already know someone with Alzheimer's, just wait. They will. And please, generously donate to the Alzheimer's Association. Together we can help find the cure. The brain you save may be your own. So in closing, remember, the end of Alzheimer's now begins with you. Thank you for being here today, and God bless you. Thank you. Get those checkbooks out.
Wow. Thank you, Barb, for sharing your story with us this morning. Your strength, your courage, and your drive is inspiring. And thank you to each of you for joining the Alzheimer's Association Reason for Hope Breakfast. I'm Fran Ziemer. Some of you may know my husband Jack was diagnosed with dementia more than 10 years ago at age 62. Breakfast was a meal that Jack and I loved. Breakfast suddenly changed 5 years ago when Jack had to move to a care facility. There was no one to start coffee for in the morning. No one with whom I could discuss newspaper stories. No one to say, a BLT during tomato season really qualified as a healthy first meal of the day. I treasured those breakfasts we had together, and I miss them terribly now. For the past 7 years, at these very early morning breakfasts, you've heard stories about how the Greater Richmond chapter of the Alzheimer's Association has helped individuals who suffer from some type of dementia, and how the chapter has helped caregivers like me become easily helped with a support system. The association's programs ease the challenges that seem insurmountable. And those people who use the chapter's resources are given hope. I know firsthand. Jack and I attended support group meetings, used counseling services, and attended countless education programs. The association gave us many reasons to have hope. At past breakfast meetings, we've asked, how many of you in this room have been impacted by the disease of dementia? For the sake of time this morning, I will not ask you to stand if you've cared for someone with the disease, are a friend or relative of someone with dementia, have lost a loved one to the disease, or are suffering from the disease yourself. I'd guess that almost all of you would stand. The Alzheimer's Association knows those of us here this morning have probably been impacted by the disease and may be facing enormous challenges. As has already been said, unlike diseases such as cancer or heart disease, for which there are cures, dementia is affecting more and more people each year, and no cure has yet, and I say yet, been found. Furthermore, Alzheimer's is not just a memory loss. As Sherry said, it is the 6th leading cause of death in our country. That's frightening. Barb's remarks this morning should have convinced you of the need for action now. But how? Can we take over all caregiving responsibilities? Highly unlikely. Can we personally supply the professional advice, education, support, and counseling our chapter currently gives? Not a chance. Can we provide more caregiver support? Probably not. Can we do anything to help increase the number of people, sufferers and caregivers, challenged by the disease? You bet. Your pledge of monetary support today can turn the tide. It can provide more support. It can facilitate more educational programs to enlighten caregivers and the public. And it can enable more medical research to happen to find that cure. So I'm standing here today to challenge each of you to help. And it's easy. A 3-year pledge of support is what I have done and will do. But gifts of any size for any length of time would be terrific. And if enough funding is gathered, we won't have to rally at 7:30 in the morning for future breakfast meetings. We can stay at home and have breakfast leisurely with our loved ones. Now I'd like to have the table hosts hand out a pledge card and envelope to each guest to consider a gift. On behalf of the more than 100,000 people in the greater Richmond area who suffer from the disease or are caretakers or caregivers getting support from the Alzheimer's Association, thank you for your past financial support, and thank you for considering a gift right now.
I want to thank Barb and Fran for sharing their stories, and also those who told their stories in the video. I ask you to please share what you have learned today with others and those who may need our services. Staff members are at a table in the registration area with chapter service information or to answer your questions. I mentioned before that our education is for the general public. We are more than happy to come speak to your civic organization, your church group, any group that might like to hear about the chapter and information on the disease. We don't want anyone to face this devastating disease alone. Thank you for your support and for taking time from your busy day to be here with us this morning. You are our reason to hope. The end of Alzheimer's starts with us. Thank you, and have a great day.